right, welcome everyone. Ready for a deep dive into something pretty amazing.
Let's do it.
Okay, so today we're tackling cognitive behavioral therapy, CBT. I
Right.
think a lot of people have heard of it, but we're going to really get into
Bro,
it.
going deep.
Exactly. And to help us, we've got some serious brain power on our side.
Oh, yeah. Who are we talking about?
We've got Jordan Peterson,
Nice.
we've got Dr. Andrew Huberman,
Love him?
and Dr. Caroline Leaf. So, like
Yeah.
heavy hitters, right?
Yeah, I'm ready to learn.
Me too. So CBT, the basic idea, it's all about how our thoughts, feelings, and actions, like they're all connected,
It's true. You can't really separate them.
right? And CBT gives us tools to work with those connections.
To make changes, right. To
Yeah.
feel better and make better choices.
That's it.
Yeah.
Okay, so to kick things off, let's talk about Dr. Huberman. He's done some mind-blowing research on how CBT actually affects our brains.
Yeah, he's like the neuroscience guy.
Totally. And he's shown how CBT can impact like our fear response and even how we deal with trauma.
Which is huge, right? Because those things can really hold us back.
Big time. And this is where we get into this concept of neuroplasticity. Have you heard
Oh,
that?
yeah. It's basically the brain's ability to change and adapt. Like, it's not fixed.
So we're not stuck with the brain we were born with.
Nope. It's constantly rewiring itself based on our experiences and, get this, our thoughts.
Okay, now that's powerful. So we can like literally rewire our brains for the better.
That's the idea behind CBT. It helps us create new, healthier neural pathways.
That's wild. So Dr. Huberman's all about the brain science of CBT. Now, let's bring in Jordan Peterson. He's got some pretty strong opinions about facing our fears.
Right. He's big on, like, stepping outside your comfort zone and all that.
Yeah, he says confronting our fears is like essential for growth. He even talks about this thing called systematic exposure.
Oh, yeah, systematic exposure. That's where you gradually expose yourself to the things you're afraid of in a controlled way.
Right, so it's not like jumping into the deep end all at once. It's more like dipping your toes in, then slowly wading deeper.
Exactly. The idea is to build up your tolerance, show yourself you can handle it.
I like that, like proving to yourself that your fears are often bigger in your head than they are in reality.
Exactly. And as you do that, you actually rewire those fear pathways in your brain, making them less intense.
Fascinating. So Peterson says, face your fears. He also talks a lot about goal setting.
Yes, he's big on that. He says it's crucial for CBT.
Why is that?
Well, think about it. If you're trying to change your thoughts and behaviors, you need to know what you're aiming for.
Makes sense. You need a target, right?
Exactly. And Peterson's all about setting SMART goals.
SMART goals. What does that mean?
It stands for specific, measurable, achievable, relevant, and time-bound.
Oh, okay, I get it. So it's not just like, I want to be happier. It's more like, I want to meditate for 10 minutes every day for the next month.
Right. That's a SMART goal. It's clear, you can track it, and it's realistic.
I love that. And I bet having those goals makes it way easier to stay motivated.
For sure. You can see your progress, celebrate small wins, and that keeps you going.
All right, so we've got Huberman talking about the brain, Peterson saying, face your fears and set goals. Now let's bring in Dr. Caroline Leaf. She brings this whole mind-body connection into CBT.
Yeah, her work is super interesting. She talks about how our thoughts actually influence our physical health.
Really? How does that work?
Well, she explains that every thought we have creates a physical reaction in our brains, like it releases chemicals and stuff.
Wow. So negative thoughts actually create negative physical changes in our brains.
That's what she says. And the reverse is true, too. Positive thoughts lead to positive changes.
So it's like our minds are way more powerful than we realize.
Exactly. And Dr. Leaf has this 5-step program that focuses on managing our thoughts and rewiring those negative patterns.
She calls it neural reconceptualization. That sounds pretty intense.
It is, but it's basically about learning to recognize and challenge our toxic thoughts.
So not just ignoring them or pretending they're not there.
No, it's about actively engaging with them, questioning them, and then choosing to replace them with healthier thoughts.
I can see how that would take some work.
It does, but the results can be amazing.
So we've got these 3 experts, each with their own take on CBT, but all emphasizing the power of our minds to change our brains and our lives.
And that's just the tip of the iceberg. CBT is constantly evolving.
Oh yeah, what's new in the world of CBT these days?
Well, technology is playing a huge role. We've got online programs, apps, even virtual reality therapy.
Virtual reality therapy, what's that like?
It's pretty cool. Like if you have a phobia of spiders, they can put you in a virtual environment with spiders and help you work through it.
Wow, so you can face your fears without actually being in danger.
Exactly. And it's super effective because it feels so real.
Technology is changing everything. What else is new in CBT?
Another big trend is personalization. Therapists are realizing that there's no one-size-fits-all approach.
Right, everyone's different. What works for one person might not work for another.
So treatment plans are becoming more tailored to individual needs, goals, and even cultural backgrounds.
That makes sense.
Yeah.
Okay, so CBT is evolving, becoming more accessible, more personalized, and it's not just for mental health anymore, right?
You got it. It's being used to treat all sorts of physical health issues too.
Like what?
Chronic pain, insomnia, stress, even eating disorders.
It's incredible how powerful our minds can be.
It really is. We have way more control over our health and well-being than we often realize.
That's a great takeaway.
Mm.
So we've covered a lot of ground here, from the brain science of CBT with Dr. Huberman, to facing fears and setting goals with Jordan Peterson, to the mind-body connection with Dr. Caroline Leaf. It's clear that CBT is a powerful tool for creating lasting change.
It's not a quick fix, but it offers practical strategies for rewiring our brains, managing our thoughts and emotions, and ultimately living a healthier, happier life.
And the best part is, it's constantly evolving, becoming more accessible and personalized every day.
Exactly. If our brains are constantly changing based on what we do and think, what kind of brain are you building right now? That's something to think about.
That's a great question to leave our listeners with. So if you're intrigued by what we've talked about today, I encourage you to explore CBT further. It might just change your life.
It just might.